Hi, my name is Lisa Rosenberry, and I manage Virtua's Mobile Health and Cancer Screening Unit and NJ Seed. Welcome to Virtua's newest addition to our mobile fleet. Great, please come in. So here's where our process starts. A patient would enter the room. They would sit here in the registration area, and they'd be serviced by our program coordinator, who would check them in for whatever medical services they were going to have today. The patient then would be met by our medical assistant, who would come, take their height, weight, and escort them to the exam room to get their screenings. This is our exam room. This is where the magic happens, and by magic, we mean medical exams. Privacy is very important to us. So our nurse practitioner will meet with every patient, conduct a health history, discuss pap smear, as well as conduct a clinical breast exam. There will also be conversations about whether colorectal testing is appropriate for the person, and that person will be able to choose between colonoscopy or a mail-away stool sample. Everyone wants to know about the fridge. Here is our fridge. Currently, it's empty, but future, we would like to be able to offer our patients various vaccines that are available. Moving on to the mammography unit. Once the patient completes with the nurse practitioner, they'll be escorted to our mammography suite. Here, we have identical privacy doors because privacy is a key to us on the unit. Come on in. Patient will have a seat and have a conversation with our breast mammographer to ask for any history, anything that's important that she know prior to taking the images. This is the machine we utilize. This is Hologic. It's 3D technology. We also have a newer feature with curved paddles that are differ from the traditional flat panels that's supposed to provide a bit more comfort. So a patient will come here, get their screening, and the mammographer will then come back to this workstation and check that the images are clear and crisp. Our goal for this program is really to increase ease of access as well as reduce barriers to care. One of those features includes our handicap accessible lift. So we will be able to support any patient regardless of ability to be able to get a mammogram on our unit. We also have this final feature. While the mammographer is checking their images, the patient can come into this private area, open the door, and are able to get dressed prior to leaving. And we also give them this complimentary bag that helps to advertise the great work that we're doing on the unit. Now let's head outside and check out the exterior. So we have 3 sliders, part of this vehicle. It provides for extra space when conducting exams. We also have a shore power line. This is what keeps our vehicle running when it's plugged in, but it's important that when we are at an event that our generator's running because our vehicle runs on generator when we are out in the field. So the sliders go back in, and let's head over to the driver's cabin. Recognizing our donors is really important to us because without them, we wouldn't have this project. Through their work, we know we will be able to provide many more cancer screenings and diagnose cancers at a much earlier stage. We couldn't have done it without them, and we were forever grateful. You can't have a vehicle like this without meeting the driver. This is our Jacqueline. Jacqueline, give the people what they want. Thanks for coming to see us, but if you want to see us, you'll have to see us on the road. We have patients we got to see.